Hello. Timmy Johnson is a 10-year-old male whose mom carried him into the emergency department. His mother states he was riding his four-wheeler on a hill when he lost control. When Timmy's mother got to him, he was lying on the ground with the four-wheeler on top of his right leg. The nurse at the front desk notices that Timmy's covered in mud, has a small laceration to his forehead, and is bleeding from his lower right leg. The lower right leg has a deformity. The patient is a type 1 diabetic and he has good control of his blood sugar with insulin previous to this injury. Vital signs that check in are a heart rate of 112, blood pressure of 138/90, and temperature of 98.4. Timmy says his pain is an 8 out of 10. The nurse assesses pulses in both feet and has strong bilateral pulses and a brisk capillary refill. So during triage, we can conclude some objective data out of our case study that Timmy is bleeding from the head and the right leg. His right lower leg has a deformity. His vital signs, heart rate of 112, blood pressure of 138/90, and his temperature is normal. He has strong bilateral pedal pulses and a brisk capillary refill. As for subjective data, we have an insulin-dependent diabetic. He has good control of his diabetes, and his pain he is rating on an 8 out of 10. Given our data that we've collected, Timmy is taken back to a room. As a primary nurse, what are your first concerns regarding this patient? So we're going to start with our priorities, the ABCs, airway, breathing, circulation. Respiratory seems to be under control based on the data we've collected so far. Circulation issues would just be the bleeding. We want to try to get that under control, stop that. Then you would further assess all the injuries, including the head lack, the leg, and perform a complete assessment. We'd be looking for open fractures versus closed fractures, whether he is fully deformed, like you see edema, things like that of that nature. And then we would assess the patient history and then control the pain. Okay, so after obtaining a complete history and assessing the wounds, we confirm that the laceration on the head is superficial and his neurostatus is intact. Timmy's mom states he hasn't had any additional vaccinations in the last 5 years. His blood glucose was assessed and his finger stick was 98. What medications might the nurse expect the physician to order? As for medications that we might expect the physician to order, one would be pain medication to help control that 8 out of 10 pain. We know that his glucose is in normal limits for a pediatric patient, so we wouldn't expect insulin. Since he hasn't had any vaccinations in the last 5 years, we might conclude since he has an open wound and he was bleeding from both the head and the leg, even if the head was superficial, he rolled his four-wheeler over in the dirt, so tetanus kind of lives in dirt, that toxoid. So he may need to receive a tetanus vaccination, or a booster actually. It's really important because that's a life-threatening condition if that was to occur. Basic care for that would be to clean the wound very well with soap and water and get some of that dirt out. That can also help prevent tetanus from occurring, as well as other bacterial infections. But tetanus is found in soil, so this would be an important booster for him to receive as of right now, considering he has these open wounds and the nature of the injury that occurred.
So Timmy now has his pain medication and now needs to be taken for an x-ray. The x-ray comes back and shows displaced fracture of the tibia and fibula. You become concerned that the wound on the right leg is in fact an open fracture. What are the possible treatment options, both medicinal and procedural, for this open fracture? So because Timmy's wound was open, we have to worry about infection, so antibiotics would be prescribed. Other complications, because it's open, he would have to have an external fixation. Because the bone broke the skin and there's so much soft tissue damage, the external fixation would be best. After the wound is relocated and repaired, closure will have to be used with sutures or staples just to keep the wound from dehiscing. After Timmy's bones have been surgically repaired, what nursing diagnosis can you use to relate to this patient? Timmy is going to have pain both from the procedure and the injury itself. We will need to manage and monitor it. He will also have impaired mobility due to not being able to weight bear on the newly repaired bones. Because there is so much damage to the lower leg, we need to worry about peripheral neurovascular dysfunction, such as decreased blood flow, excessive edema, and very importantly, thrombus formation. Timmy is also going to have a deficit in knowledge related to all the new procedures, signs of complications, and how to live with his new normal for the next 6 to 8 weeks while his bones heal. He is also at risk for impaired healing due to the complications that can arise from being a type 1 diabetic. We will monitor his blood sugar level and keep it in with normal limits. What are the common complications associated with tibial fractures that the nurse should be assessing for? Common complications associated with tibial fractures include compartment syndrome, fat embolism syndrome, delayed union or non-union, possible infection associated with open fracture. Compartment syndrome is a complication to watch out for because the fascia around the lower leg is very restricting and is one of the most common sites for this complication. Fat embolism syndrome can arise because the bone has been broken and could release fat globules into the blood and cause blood flow blockage problems such as pulmonary edema, stroke, or heart attack. The tibia and fibula can also have delayed union or non-union where the bones don't fuse back together after repair. This fracture being an open wound also brings with it the concern of infection. Timmy's story continues. Timmy is admitted following his surgery. His pain has been well controlled with medications and positioning. His blood glucose levels have been fluctuating and his insulin was increased slightly. On the second day post-surgery, the nurse performs the morning shift assessment. Timmy is rating a pain as 12 out of 10. The nurse notes increased swelling in the right lower extremity. The extremity is pale and Timmy states, "It feels like my leg is going to explode." How would the nurse further assess his neurovascular condition, and what do his developing signs and symptoms suggest?
Based on Timmy's new symptoms, the nurse should suspect that compartment syndrome may have developed. She's going to assess what are known as the 6 P's that are found with compartment syndrome. That's pain that's out of proportion, pressure, paresthesia or numbness and tingling, pallor, paralysis, which would be loss of function, and pulselessness. So of course with paralysis and pulselessness, these are very serious things. You want to notify the physician immediately. Compartment syndrome that's left untreated can result in amputation. It's a medical emergency.
So when a nurse suspects compartment syndrome, they want to do a good focus assessment of the limb. They're going to assess for pain. The patient would be in a lot of pain. Are you having pain right now?
Yeah.
Can you rate it on a scale of 0 to 10?
I think it's 3/10.
Okay. Can you just tell me what the pain feels like?
It's like pressure kind of pain.
Okay, so pressure would also be a sign of compartment syndrome. You're going to look for swelling in the area, as well as the color. If it was compartment syndrome, it would be pale. There would be pallor as one of the P's. Can you feel me touching your foot?
Yep.
Are you having any tingling?
No.
Okay. You're also going to assess for paralysis. Can you pull up against my hands? Push down. All right. As well as pulselessness. So you're going to assess the pedal pulse, as well as the posterior tibialis pulse. All right. All right, so this is the cart we have in the ER for monitoring when we suspect compartment syndrome. In it is this big case that has the compartment syndrome monitor. And then this cord, and what you do is you take like a normal IV catheter, a big one, and you go in the area that you suspect compartment syndrome for the swelling. When you put the needle in, you actually just use this part. So this probe feeds through this, which would be in the leg, and hooks into the monitor and gives you a number for the pressure, kind of like this.
What treatment can the nurse expect to be ordered for Timmy's compartment syndrome? In compartment syndrome, a fasciotomy is performed to save the limb. This procedure involves cutting the fascia to release pressure in the compartment, and the incision is left open to prevent the pressure from reoccurring.
So there are 4 compartments in the leg. There's an anterior, a lateral, a posterior with a deep and a superficial compartment, as well as a medial compartment. Most of the compartment syndromes happen in the lateral aspect of the leg because the fascia is so tight on that area that it builds pressure more easily. And sometimes will have to be released through fasciotomy.
At fasciotomy, once compartment syndrome is diagnosed, it is considered a medical emergency. Immediate release of the pressure is imperative to the circulation of the blood flow so they do not end up losing that limb. You will come in most often, a fasciotomy is performed vertically. They take an incision deep and they go straight down like such, and they leave that incision open to prevent compartment syndrome from reoccurring. Eventually that wound is normally like wet to dry dressings treated with that, but they leave it open until that compartment syndrome is no longer at risk. That edema goes down and the pain and the other sensations return. Also, a lot of times with these type of like incisions, since they are so big and they're gaping, they will require wound vac and antibiotics to prevent any types of infections. But they are closely monitored, and this is a medical emergency.
The pressure is released, and Timmy's leg size, color, feeling, and peripheral pulses have returned to normal. What nursing interventions will the nurse implement to continue Timmy's recovery? So, after the pressure is released by fasciotomy, the nurse still needs to assess frequently for complications and for other things that may be related to the injury or the procedure itself. Such things would be assessing pain and listening to the client's description of pain. Note emotional and behavioral responses to the patient's immobility. Especially since the patient is 10, there could be feelings of frustration or powerlessness, or just general frustration for being stuck in bed. You want to support affected body parts using pillows to maintain a position of function and reduce the risk of additional wounds. Stress proper hand hygiene for all caregivers, so just to prevent against additional infection risks. Again, maintain aseptic or sterile technique for all procedures, which is also an infection control measure. And assess skin conditions around the site, noting inflammation and drainage, which would be also observing for signs of developing infection. What psychosocial aspects should the nurse be concerned about? When it comes to this patient, there are several psychosocial concerns the nurse should have. One big one, especially with the patient's young age and being a pediatric patient, is fear. This fear could either come just from the procedure itself, the immunizations, any of that, or from temporary separation from parents as they prep for surgery, lack of knowledge about what's going on, or inability to make decisions, or any of that. There also may be some low self-esteem related to the external fixation device or the wound from the fasciotomy. The fact that he can't get out of bed and do things, all of this could contribute to some psychosocial problem.